Hey, happy Friday, everybody. It's Chamber Check-in time. And today I get to share with everyone the association. It's called the Independent Doctors of Idaho. And today I have Executive Director Nancy Powell with me. Hi, Nancy.
Hi, Paul. How are you?
I'm awesome. Happy Friday.
Thank you.
I'm looking forward to sharing more and educating the public on what you guys do. But first, I got to thank our series sponsor for these check-ins. It's Delta Dental of Idaho. Nancy, you know Delta Dental of Idaho. They've been around for 50 years, offering high-quality dental insurance benefits that are backed and designed by the largest network of dentists in the country. So I get to share some of their fun factoids from their Tooth Truth series. Here we go.
Great.
One of the benefits to employees in having a good dental plan is that 78% of people are more likely to go in for their preventive and restorative type services. Annual dental checkups is part of prevention. People that have dental benefits are 40% more likely to schedule their routine cleaning. Preventive is so important. It keeps your mouth healthy and it keeps your overall body healthy too.
So true. I got my next dental appointment coming up here soon. So,
well, it just reminded me I need to do mine. So,
right?
I'm like, oh yeah, I better get on that.
So, Nancy, tell us what Independent Doctors of Idaho is.
Great. Well, yeah, I'm happy to. So, we are just that. We are a network of independent physicians throughout the valley. We go from Mountain Home to Weiser. So we have a little over 700 providers with the Independent Doctors of Idaho. About half of those are physicians and the other half are advanced practice providers, which we consider nurse practitioners, physician associates, and nurse anesthetists. So yeah, and so independent, meaning that we're physician owned. So we're not, none of our practices are owned by large health systems.
Okay, and so when my doctor is an independent doc as well with Center for Lifetime Health and Dr. Eck. And when I went into their offices, this is kind of your directory that you have out there in the public. And inside of these are all the different docs that you guys that are a part of your group. And what was surprising to me is there's a wide swath of different services from independent docs. Tell us more about that.
So basically, we have just about every specialty you can think of in the Independent Doctors of Idaho. And then there's really only two specialties that we don't have. We don't have independent cardiologists and we don't have independent pulmonologists. So all the cardiologists and pulmonologists in the valley are currently employed with one of the two health systems. We do utilize the St. Alphonsus network as our RAP network. So that's where we can direct our patients to for those types of services is to St. Alphonsus Cardiology and Pulmonary. But basically everything else that you could possibly think that you might need, we can provide as the Independent Doctors of Idaho. So we're really proud of that, actually. And so, yeah, it's going to be great care at a reasonable cost.
Now, one of the other cool things about this program is we get to learn kind of the about us story and the origin stories of our chamber members. So tell us and share kind of the origin story. How did the association get started and why?
It's kind of fun. It literally got started on the back of a napkin.
I love it.
I know, right? It's just that all great things start on the back of a napkin, right?
Yep.
So our founder, Dr. Hessing, and along with the family physician, Dr. Brian Pogue, actually sat in the hospital cafeteria at Treasure Valley Hospital, and they were concerned about how many physician groups are being purchased by hospital systems in the valley. And they said, we need a way to let independents know that there's others out there. So a way to kind of get together and say, hey, you're not alone. There's more of us than you think. And so that's kind of how it all started. And so that's really what it started, was just a way to say, hey, we're out there, and here we are, and here's what we do, and here's what we can do. So that started in 2013. And then in 2015, they formed what's called an IPA. So it's an Independent Practice Association, to bring together as a network so that we could provide services kind of as a network. And so in 2017, they had their first contract with Blue Cross of Idaho. So, yeah. So, and now we have 4 contracts with Blue Cross of Idaho. So, and so that's kind of how we started and why we started. And now it's really just kind of blossomed from there. And, initially in 2013, we had like 100 doctors, and now we have over 700 providers. So, yeah, we're excited. The physicians are, it's a learning process for all of us as to exactly, what we can do and what we should be doing, and pulling together during times of crisis and getting information out to everybody is kind of what we're all about.
So tell me about the patient side of this. What types of benefits and what advantages are there for patients to choose one of your independent docs?
So, well, the biggest advantage is you're going to have a really strong physician-patient relationship, in my opinion, because you're not just a number, because you're part of usually what's considered a smaller practice. And so you have a really good one-on-one relationship. I'm sure you have a great relationship with Dr. Eck.
Yep.
And he knows and remembers you, and he knows your history. So, so I think that's the number one thing. The second thing that just is kind of helpful is that you're going to pay less for your services.
Right.
So independent practices, especially independent facilities, which most of your independent practices are going to utilize, you're going to save anywhere from 20 to 50% on your services. So it can be huge. So that's another benefit. And that's kind of what we like to focus on, not focus on, but we do really stress that, because if we're going to reduce premiums over time, we have to lower costs. And the best way to lower costs is to make sure you get the right care at the right place, so that we can, you don't need to go to the emergency room if you sprained your ankle. You can go to an urgent care facility for that. Even if you slice your finger, you could go to urgent care versus emergency room.
Right.
So, just trying to educate our patients too as to the appropriate place for their care is also very important to us. And so we strive really hard to do something like that on a daily basis.
And what is your territory? Is it the entire state of Idaho, I would imagine, since it's Independent Doctors of Idaho?
It's actually not from a network standpoint. It's not. It's really just let's see, Mountain Home to Weiser. So we have Elmore County, Ada County, Canyon County, Owyhee County, Payette County. I think that's probably it. Jim, wait, where is Emmett in Boise County? I don't know. I think they are. So Boise County and Jim, I think. So that'd be there's about 7 counties that we represent. So, yeah.
How many doctors or physicians or clinics, you may not know the answer, are there in that territory that you serve?
So we have about 130 clinics. We have about 355 physicians and about the same number of advanced practice providers. So nurse practitioners or physician associates who actually practice with a physician. So that's part of who we are. So then, so they have what we call physician extenders, if you will, sort of in the nurse practitioners and the physician associates who provide great care in our physician offices as well.
Are you seeing a staffing issue and labor shortages in your industry, Nancy?
Oh, yes, it's terrible. Luckily, or not luckily, but we are because the hospitals are sort of burning people out, maybe, if you will. I don't know
Right.
with what's going on. So we do have some people that are coming into the private practices, but still it's difficult. There's, a lot of people are just jumping ship and getting out of healthcare altogether. And then we're just in a short labor, market right now, and where you're almost really competing with even the food service people have increased their wages. So you're really competing with just about everybody for staffing. And so, yeah, it's difficult. It's definitely, and because you're in healthcare, people are a little more leery to want to come work for you at this point in time.
Okay. All right.
Yeah.
Hey, we talked about some of the patient benefits of choosing an independent doc. What are some of the independent doc benefits for being a part of your organization?
Yeah. So hopefully we provide some service for them that they appreciate. But as a group, so we have contracts. So we actually bring them patients. So we have, a network of a little over 20,000 patients right now in the network that we see. And so that's one benefit. We do marketing on behalf of the network. We do website so that people can find them, and so those are some of the benefits that for the physicians, and then just a way to know that you're not alone, and that you have I can have a physician call me and say, hey, I have this kind of question and I'm not sure who to go to, and I'm, well, let me see who I can find that might be able to help you. And so it's just kind of a network of knowing that you're not alone, and that you've got resources that of people and places that are willing to really step up and help you out.
I love it. At the bottom of the screen, scrolling there, I have your guys' website. And in that website, there's a wealth of information, and there's a list, of all the different docs and that are a part of your organization. Hey, is there anything else that, while we have you today, Nancy, that you'd like to educate the public on about Independent Docs of Idaho?
Sure. Well, one thing I'd like to kind of suggest is get your annual wellness done.
Right.
And we have primary care physicians that are more than willing and eager to help you do that. It's just so important for people to, make sure that they, it's like you have your car, and what do you do with your car? You change the oil, right? And why do you do that? So that your car doesn't break down. Right? Well, think of your annual wellness visit as the same thing, except for your body is like the most expensive equipment that you can ever have to repair.
Well, I'm so glad that you mentioned that, because in that short little Delta Dental clip, it was about proactive healthcare.
Right, exactly.
And it's so tough. It's one of the favorite sayings I learned from a conference many years ago is, we as humans never change until the pain to change is less than the pain to stay the same. And so how can we be more proactive? And I can see just by our conversation today that go get your annual wellness check. Go choose one of the docs from Independent Doctors of Idaho. Just like Nancy said, their physicians are skilled. They know you by name. Start a relationship with them and keep up with those annual checkups, right?
Right, exactly. Because the more they know you, the more they're going to be able to spot when things aren't right.
Yep.
So, and the earlier get your cancer screenings done, the earlier that things are detected, the better off you're going to be. And there's so many things that can be, even cured now if caught early enough in the stages. So, yeah, so it's very important. And then keep in mind, as a consumer, you have a choice as to where you go.
Yep.
And where you go matters, and it's going to impact your pocketbook personally, but it also will impact your employer's pocketbook. If you choose to go to a high cost facility, Well, somebody's paying that bill. It's not the insurance company. It's actually you through the premiums. And so in order to reduce those premiums over time, you've got to bring your costs down. And the only way to do that is to be a good consumer.
Right.
And to pay attention as to where you get your care and know that I'm not saying large health systems are very important.
Absolutely.
They are very important and they provide great care. And we're lucky to be in the valley where we have some really good large health systems. I would go to either one of them, to be honest with you.
Yep.
But I only want to go to them if I have to.
Right.
You know, I don't want to go to them for care that's not that can be done somewhere else at a much more affordable price. So I think as consumers that we need to pay attention to that. And I know that before I actually joined, I worked for a large health system. I did not know that there was a difference in rates between different hospitals. I didn't know that. And I don't think most consumers do. And so I think that when it comes time to, heaven forbid, should you need a surgery, do your homework.
Right.
Do your homework and find out and ask your physician because they generally know, because we've been educating them. They didn't know. I can guarantee you they didn't know, but now they do. And they have an understanding. And you just know that when you get things done at an independent facility, it is going to be cheaper. And why is it? Well, because they don't have to offer as many services as a full system hospital does.
Okay. I was going to ask you, how is it cheaper? Is it facility costs that are plugged into different and that overall bill, or is it that they don't have to have all of the services under one?
Right. Right.
Explains it well. Okay.
Yeah.
So for whomever is listening today and they're looking to connect with one of Nancy's independent docs, just check out their website. They've got a great list of all their services and different clinics. And then if you're out and around, grab one of these as well. They have a good list of all their docs. So Nancy, thank you so much for taking some time to educate me and the public a little bit more about your association. It means a lot.
My pleasure, Paul. Thank you for having me. I appreciate it. Have a happy weekend.
You too. Bye.
Bye now. Bye.